clinic existed, people didn't know that they could cure their eyes. For them it was something inevitable that comes with age, and they will never do anything. But because this clinic has such a wide coverage, they now start to hear story that I can go to this hospital and I will see again, or at least they will do something with my eye.
Those are three different insurance. This is Mutuelle de Santé. This is the very cheapest one for just the local population. And just this is the Mutuelle de Santé. With this, you have to pay 3,000 per year. They try to pay just per tranche, per part, because you have to pay for the whole family. There are some willing to pay just at the starting of the year, or at the middle of the year, even at the end. It depends on the financial situation of the family.
First go to the do visual acuity. It's not about the pathology, it's just to see how much they see yet. And then they will have consultation. Consultation are made by ophthalmic nurses who can see, and if the case is more difficult, the doctors will be present also to do the consultation. Ophthalmic nurses are nurses specially trained in ophthalmology, so they can do refraction, they can do small diagnosed. In Rwanda, ophthalmic nurses, it's about 50, so it's also not that many.
How many patients per day you have?
We have around 130. But with all the emergencies, sometimes it's 150 patients. I finished my ophthalmology training in 2005. I worked a bit in France, but I worked in Canada for 2 years, and now I'm back here. So for all these years, I've been dealing with patients who are not from my country, you know, and now I'm back. So I'm dealing with patients who are speaking my language, who are my own people. So this gives me the strength, you know, to carry on, because they really need ophthalmologists.
There's only 12 ophthalmologists here in Rwanda, which means there's about one ophthalmologist for 1 million population. Most importantly is also that the ophthalmologists are very often working in private practice with prices not affordable for most of the population. There is not many eye care services around the country, and this hospital is doing, for instance, about 80% of all the surgical intervention in the country. So per year there is about between 3,000 and 4,000 surgeries, and we do about 300 operations of children. Children treatments are delivered for free. The treatments for the children, consultation, even food or transport can be provided for free for children.
Here we have many kids who come because they have intraocular tumors, you know. These are cancers in their eyes. Many times they come, it's a bit late, you know, and we have to treat them, but knowing that this eye is going to be removed.
How many operations you do during one day, usually?
It depends, between 10, 30, whatever. We have 3 tables, actually, and we can have a lot of operation now. We put this mark for the patient before surgery, that then we will know that right eye or left eye is operated, but at the end we can remove it.
The operation will cost something like 40,000, but because we are in Rwanda and most people are covered with health insurance, it means they only pay 10% of the full price. We do have funds for poor patients, so patients who cannot even afford the health insurance or cannot afford food or transport, there is a fund specially foreseen for that.
muturutse mu kahe karere muturutse ahagana
duturutse i Musanze karere ka Kamonyi.
This is coming from Kamonyi district. It's around 30 kilometers. Yes, they are coming by bus.
Uko nkabona bikesekeze nk'ubu ngubu ndareba nk'igihu cyabuditse hasi.
Ariko ubundi ntibikurya.
Ntabwo bindi.
Yes, there is no other problem, but he doesn't see. Now problem with the cataract. This is why he's here. Nta mituweli ugira?
Mituweli ndagira.
Yes, he has mituweli to something, he is insured. And just till now, he paid 6,000 Rwandan francs.
And is it a lot for him? Did he save for a long time the money to come here?
Kuwa gatatu uje barambwira bati tugomba kubaga ukishyura amafaranga 6,000. Mpita yishyura rero.
Yes, he has it. It's not difficult for me to find 6,000.
Money is definitely what will help the hospital function and have the good equipment and also being affordable to the poor. I mean, this hospital could work very well on its own revenue, but will not be accessible to the poor population. In Rwanda, it could be malnutrition, so there is a lack of vitamin A. It's an important factor of losing sight. It could be disease. It could be there is cancer of the eye. One increasing trend, and that is due to diabetes. And diabetes is really at the rising. We always think it's a disease of the rich people, but actually it's a disease that is on the rise also in Rwanda within the poor population.